Hi guys, welcome to my YouTube channel. It's Joycel Sapong and I've come to you with something different today. Have you heard that NCLEX is changing? If you don't want any wahala, my brother, my sister, you have only 3 months left to sit for your NCLEX. If not, you're going to be faced with a new gen. But I think it is a positive thing, because looking at what that we should appreciate it, because in a way it is for the betterment of the patient, just to get good and quality nurses who will come out and provide quality care for patients. So it will be good. So 2 reasons that they are bringing in or introducing this new gen question is to find a model to assess clinical judgment of nurses. So they want the questions to be more clinical, like things that you are actually going to experience or things that you're going to expect at the ward or at the ward. For instance, you have a question where it is an actual patient management rather than an abstract thing in the book. So instead of asking about a medication that you don't even know, they're going to ask you something more clinical, more practical, which is written. I don't know if it makes sense. Also, this new gen question is going to ask better questions to help nurses think critically when attending to patients. So I think it's for a good cause. They have we the nurses at heart. They want us to be good nurses. They want to have a very good nurses at the forefront, that when it comes to providing care, they know for sure that excellent care is being delivered because of how the exam system is set. With the exam structure, is it going to change? Yes. So they're going to add some to it and they're going to take some out, but it's still going to be the single question per screen. And with the scoring, how they're going to score this one is a little bit different. They're going to use what they call the partial scoring method, where they give candidates a partial score for their knowledge. So for instance, if you have select all that apply question, and let's say you selected 3 correct answers instead of 4, they're still going to mark you for the 3, unlike before where you would have been wrong for all. But they will mark you for the 3, and then that will be, you will not have the total 4. So it's going to be like +1 -1. So if you have a wrong answer, it's going to cancel one correct answer that you had, basically. So I think what this scoring method is trying to encourage is that as nurses, if you get to a point, or if you are doing something, delivering care, and you do not know something, you just stop or you seek help from somewhere, rather than you guessing it and causing harm to somebody. So in a way, thinking about it, I think is very good, and it's going to help us, because sometimes you know some 3 ones, some 3 correct answers, but you're not so sure of some two answers. But if you are able to select those 2 correct, it's going to give you some marks, which I think is very good. So what are some of the problems that I think might arise, because it's a new thing that is coming in play and people are not used to it? It's absolutely new to everybody. So definitely there are going to be some problems, there are going to be some challenges. So one of them that I think is going to happen is that most of the question ones that are outside are of the old method or the old way. So it would have to be people going in and coming out to tell us, oh, this is how it was, or even though they have given us a sample or they have given us an idea of how it's going to look like, it will still never be the same as you sitting there and answering questions that are like that. So all the question banks are in the old type, and then you are studying those old types to prepare yourself for this new type. So it's going to be a little bit of a challenge. Also, this is like a test or a trial thing, so nobody knows how it's going to go. It can go very, very good for the nurses or we the candidates going in, and then it can be very, very difficult because this NCLEX is difficult on itself already, and they don't think it's enough. They don't think it assesses critical thinking enough. And they want to change it. So well, it can go anyway. So let's see. I'm just waiting for somebody to go and do it after March, and then they'll come and tell us their experience if they think it's better than the old one. Or I want somebody who did not pass the old one and then went to sit for the new next gen question and then compare and let us know how it is. This is the little I have to share about the next generation questions, but I think it's going to be a great one and it's going to help the nurses to pass. So guys, don't be scared at all. Just relax, study, and then go and get it, because we are winning. 2023 is a year that we are all winning together. Thank you for watching, and if you are returning, or you are warmly welcome to stay, and if this is your first time chancing on one of my videos, you are welcome. And if you are returning to watch more, you are also welcome. Thank you guys for watching, and thank you for always supporting me. So please like, comment, share to your friends, and tell me what you think, and tell me what you would want to see next in the next video. Bye.